How do I do liposuction differently than other plastic surgeons? People have a certain impression of themselves when they see themselves in the mirror. Most everybody has some area that they'd like to improve, which is to make smaller and remove excess fat. Liposuction does not have to be major surgery. And I think that when people are thinking about doing cosmetic surgery in general, or specifically liposuction, from what they see on the internet and talking to other people, it seems like major surgery, and that keeps people away from doing it. What I've found is that in most cases, my patients tend to be healthy and active and in reasonably good shape and just have certain areas that need to be shaped. In those situations, it's entirely possible to do a liposuction procedure with local anesthetic as long as it's a limited area. And for a lot of people, it's maybe on the abdomen or the waist, the inner thigh. And in order to do those under local anesthetic, what I do is to make a small puncture in 1 or 2 spots. In order to do that, I can give a little shot of local anesthetic. Once that's done, I actually don't need to use anything sharp. The cannula that's used to give the medicine is blunt. The anesthetic goes in very slowly, and because people are awake, they can tell me if something is bothering them. I can slow down or stop, give them a little bit more medicine in those areas. And I also remove the fat very slowly using a very blunt liposuction cannula. Once the procedure is done, because they've been able to tell me areas that were uncomfortable where I gave them extra medicine, post-operatively they have very little discomfort. Because I have to go slowly, they also don't bruise as much, so that their recovery is a lot less painful. Because they're able to then just get up, put on their garment, and go about their business, they can go back to work quickly. They can handle things around the house, take care of their kids, and do all the things that they normally do. They're just a little bit sore for several days. But instead of taking every patient who wants to have liposuction to the hospital and giving them general anesthesia, I can select a good number of those patients who can tolerate it very well under local anesthetic. The other thing that I can do, because it's under local anesthesia and the additional costs of the facility and anesthesiologists aren't involved, some people will decide that they want to have their waist suctioned and then maybe come back after a month or 2 and have another area suctioned. But because the recovery is so quick, they really don't lose anything by doing that. If I do a procedure on a Friday, by Monday they're back to work anyway. So that breaking it up into a couple of smaller procedures doesn't end up being a problem. Having a surgery under general anesthesia is a pretty big deal. So once you've done that, you don't want to be having to go back doing multiple procedures, because it really takes away from work and home and other your daily lifestyle functions. So when I do it, I try to take the person's lifestyle into consideration and make sure that they can do these types of things without interrupting their life too much and recover smoothly and have a great result. This is Dr. Kutty. If you think that you would be a good candidate for liposuction and you'd like to talk about it or anything else to make you look better, please give us a call. Our phone number is 281-313-0551.